Good day everyone, I am Janine Lembak and I am the one of the members of Group 7. The problem in the Philippines has primarily been viewed as an issue of law enforcement and criminality, and the government has focused on implementing a policy of criminalization and punishment. So yung escalation of the human rights violation has caught the attention of the groups in the Philippines as well as the international community. So according nga po sa Dangerous Drugs Board or the DDB, the government agency mandated to formulate policies on illegal drugs in the Philippines. So merong 1.8 million current drug users in the Philippines and 4.8 million Filipinos report having used illegal drugs at least once in their lives. So more than 3/4 of drug users are adults, so equivalent na is 91%. So sa males is 87% and have reached high school, which is 80%. So more than 2/3 or the 67% are employed. So sa mga employed. So the most commonly used drug in the Philippines is a variant of methamphetamine called yung shabu or the poor man's cocaine. So sa Philippines talaga is commonly is the shabu or what we call the methamphetamine hydrochloride. So according to a 2012 United Nations report, so yung Philippines has the highest rate of methamphetamine abuse among countries in East Asia. So about 2.2% of Filipinos between the ages 16 hanggang 64 years old were using the methamphetamine hydrochloride. Drug and substance use has a long history in the Philippines. So intoxicating beverages, so fermented from rice, sugar cane, and from nipa and coconut palms were popular drinks sa Pilipinas. So yung mga tinatawag nating tuba. And the betel leaf chewing was a common practice. So today, isa sa mga problema is the substance use or the abuse remains as one of the major social problems sa Philippines. So it was estimated in 2004 that drug users nationwide numbered 3.4 million. So masyadong mataas po. So it is despite the very steep penalties. So including yung death imposed by the law on the sale and consumption of prohibited drugs. So one disturbing aspect of the problem is the fact that yung drug abusers are getting younger. Mas bumabata po yung mga drug abusers. So according sa statistical figures, over the last decade revealed the trend towards a decreasing age. So mas bumabata po yung mga gumagamit. So in the 50s, the age of drug offenders ranged between 40 to 55 years old. So in the 80s, the average age of drug users was 25. More recent data, so pinakabagong data indicate the initiation to drug use starts at the young age of 8 to 9 years old. One of the key impacts of illicit drug use on society is the negative health consequences experienced by its member. So yung drug use also puts a heavy financial burden on individuals, families, and society. So yung evolution of the complex global illicit drug problem is clearly driven by a range of factors. So social, demographic trends are influential, such as the population's gender, yung age, and the rate of urbanization. We know what can and needs to be done to help reduce the burden of psychoactive substance use. So therefore, WHO or the WHO is committed to assisting countries in the development, organization, monitoring, and evaluation of treatment and other services. So yung mga person's vulnerability to becoming addicted appears to depend primarily on the three factors, which are the genetics, the environment, and the age of first use. So when it comes to genetics, so if an individual is may mga relatives sila with histories of the drug or alcohol problems, it may indicate that they face a heightened risk of developing addictions themselves. So maari nilang makuha yung mga ganyang styles like the drug abuse or the alcohol abuse sa katawan nila, depende sa mga histories ng family nila. Kung meron mang ganyan sa isa sa mga family, pero nakadepende pa naman din sa individual kung talagang i-a-adapt nila sa katawan nila yun. Second is yung environment. So the circumstances of how a person grows up and lives their lives, including their families, friends, Peer pressure, stresses, and their inherent fears and insecurities can influence the risk of an individual misusing alcohol and drugs. So, nakadepende sa kung sino yung nakakasalamuho ng isang individual na pwede niyang ma-adapt balang araw or hanggang sa pagtanda niya is madadala niyo yung mga ganyang styles like yung paggamit ng drugs or yung alcohol. So, the third is the age of first use. So, according to science, it's found out that the earlier a person starts using drugs or alcohol, so the greater their risk of developing addiction. So, scientists are still searching for a better understanding of the complexities of the brain and about the disease of addiction. But for the experts concede that there is not yet a way of knowing in advance how a person may react to addictive substances before they put them into their bodies or what longer-term risk of addiction they face. So, hindi pa rin matukoy kung ano nga ba yung pwedeng maging epekto talaga totally sa katawan ng tao or paano nila na-adapt or hindi nila kayang ialis sa katawan nila kaya nagkukos siya ng abuse sa katawan. Next is about the mental health issues, suicide and suicidal ideation. So, the WHO Special Initiative for Mental Health aiming to establish accessible and affordable mental health care, reported insights into the challenges faced by the participating countries, so including the Philippines. These challenges encompass service delivery, governance, workforce, financing, and stigma. So in the Philippines, the prevalence of mental disorders range from between 11.3% and 11.6%, with an average annual increase of 2.0, increasing from 7.2 to 12.5 million Filipinos diagnosed with a mental disorder between 1990 and 2019. So, anxiety and depression are the prevailing conditions. So, considering these challenges, WHO advocated a strategic approach comprising increasing political prioritization and funding, developing a sustainable and transformative model of care, and promoting a collaborative approach to practical context-specific measures. WHO also introduced the Consolidated Framework for Implementation Research. So this framework systematically assesses the factors influencing mental health care accessibility and affordability, which include intervention, internal and external settings, so individuals and the process. Mental health services in the country are concentrated in psychiatric hospitals and outpatient care services in general hospitals, so with limited integration into primary health care and informal community support. Therefore, intervention should prioritize the establishment of community-based mental health services and processes to improve mental health care accessibility and affordability. It is also pivotal to advocate for integrating different levels of care to ensure an efficient and responsive mental health care system. The external setting of the WHO framework encompasses the complex environment influencing intervention. So, Filipino culture offers valuable resources to enhance Filipinos' mental well-being and social support, encompassing tight-knit community structures and Filipino psychology concepts such as kapwa. So, however, stigma rooted in Filipino culture remains a challenge, with some attributing mental disorders to personal weaknesses or supernatural causes. As a result, mental disorders are seen as socially unacceptable, leading Filipinos to turn to friends and families for assistance and avoid professional mental health care. However, strengthening current developments is essential for transforming mental health services. Efficient resource utilization is critical to a sustainable model of care. Lastly, a shared approach to contextualized interventions along with informed stakeholders is vital to transforming Philippine mental health care. Republic Act No. 9165. It is an act instituting the Comprehensive Dangerous Drugs Act of 2002. So, repealing Republic Act No. 6425, otherwise known as the Dangerous Drugs Act of 1972, as amended providing funds, therefore, and for other purposes. So, it is the policy of the state to safeguard the integrity of its territory and well-being of its citizenry particularly the youth, from the harmful effects of dangerous drugs on their physical and mental well-being, and to defend the same against acts or omissions detrimental to their development and preservation. In view of the foregoing, the state needs to enhance further the efficacy of the law against dangerous drugs, it being one of today's more serious social ills. It regulates and controls the use, sale, and distribution of dangerous drugs, categorizing them into different schedules based on their potential for abuse and medical use, and includes a list of controlled substances such as codeine, cocaine, opium, and various other drugs. So the government is responsible for pursuing an intensive and unrelenting campaign against the trafficking and use of dangerous drugs. It implements an integrated system of planning, implementation, and enforcement of anti-drug abuse policies, programs, and projects. The government aims to achieve a balance in the National Drug Control Program to ensure that people with legitimate medical needs are not prevented from being treated with appropriate medications, including dangerous drugs. Republic Act number 10586, it is an act penalizing person driving under the influence of alcohol, dangerous drugs, and similar substances, and for other purposes. So, pursuant to the constitutional principle that recognizes the protection of life and property and the promotion of the general welfare as essential for the enjoyment of the blessing of democracy. So, it is hereby declared the policy of the state to ensure road safety through the observance of the citizenry of responsible and ethical driving standards. So, ito yung mga batas para sa mga nagmamaneho ng lasing that can cause accident to them, not also to them, but to other people. House Bill number 6976, this act shall be known as the Anti-Underage Drinking Act, an act prohibiting the access of minors to alcoholic beverages and penalizing individuals and establishments that furnish alcohol to minors. So this bill regulates and restricts the access of the youth to alcoholic beverages. So the state recognizes the vital role of the youth in nation building and shall promote and protect their physical, moral, spiritual, intellectual, and social well-being. Lalo na sa panahon ngayon na pabata ng pabata ang umiinom at gumagamit ng mga drugs. House Bill number 1753, seeking to ban unqualified individuals from purchasing alcohol products and to prohibit others from buying alcohol products for them. So these unqualified individuals are noted as those below the age of 21 years and those who are above 21 but are unable to fully take care of themselves or protect themselves from abuse, neglect, cruelty, exploitation, or discrimination because of a physical or mental disability or condition. Senate Bill number 654, so this act shall be known as the Protection of Minors from Vices Act of 2004. So an act prohibiting the sale of cigars, cigarettes, and alcoholic or intoxicating liquor or beverages to minors. So pinagbabawal yung mga bata na bumili sa mga establishments ng mga liquor, mga cigarettes, lalo na sa mga minors po. Pinagbabawal siya. Ito yung Republic Act number 11036. This act shall be known as the Mental Health Act, an act establishing a national mental health policy for the purpose of enhancing the delivery of integrated mental health services, promoting and protecting the rights of persons utilizing psychiatric, neurologic, and psychosocial health services, appropriating funds therefore and for other purposes. The Mental Health Act in the Philippines aims to enhance mental health services, protect the rights of individuals seeking mental health care, and promote the well-being and inclusion of those affected by mental health conditions. House Bill number 1408. This act is to provide early youth suicide intervention and prevention expansion. This act shall be known as the Youth Suicide Prevention Act of 2019. According to World Health Organization, suicide is the second leading cause of death among 15 to 29 years old. So among this, the 20 to 24 age bracket records the highest number of suicide cases. So this bill takes the initial step in preventing suicide among the youth. It proposed to create the National Youth Prevention Coordinating Council, which will formulate programs and strategies for youth suicide early intervention, prevention, and responses. Senate Bill number 1946. This act is to empower the Department of Education, the Commission on Higher Education, and the Technical Education and Skills Development Authority to require all the school heads to report all the incidents of student suicide in their respective schools, whether consummated, frustrated, or attempted, and to provide a program for student suicide early intervention and prevention. So this act shall be known as the Student Suicide Prevention Act of 2005. So this law, authored by Senator Miriam Defensor Santiago.